Vision and hearing loss in the elderly old age marks a period of significant physical, psychological, and cognitive changes. Among these, vision and hearing loss are two of the most common issues, directly impacting the quality of life, communication ability, and independence of older adults. While these are natural physiological processes associated with aging, if not detected and addressed early, they can lead to serious consequences, both physically and mentally. Vision loss causes blurred vision, difficulty reading, and an inability to recognize faces or objects, especially in low-light conditions. Common causes include presbyopia, cataracts, glaucoma, macular degeneration, and diabetic retinopathy. These problems not only affect daily activities but also increase the risk of falls and accidents while navigating or using household devices. Similarly, hearing loss in older adults often manifests as difficulty hearing, misunderstanding conversations, or needing others to speak loudly or turn up the TV volume excessively. This can hinder communication, increase social isolation, and lead to low self-esteem or depression. Common causes include age-related inner ear degeneration, chronic ear infections, earwax buildup, or prolonged exposure to loud noises. The combination of vision and hearing loss significantly hampers daily functioning, reduces independence, and increases reliance on caregivers. Therefore, prevention, early intervention, and appropriate care are essential. Regular checkups, proper nutrition, eye and ear exercises, and assistive devices, e.g., reading glasses, hearing aids, are vital to maintaining a high quality of life and emotional well-being for the elderly. Accutonym, the vision loss in the elderly situation and importance. As the body ages, it begins to show signs of decline, with sensory functions, especially vision, among the most noticeable. The eyes, often referred to as the windows to the soul, play a vital role in communication, learning, orientation, and maintaining personal independence. Over time, however, the eyes lose their flexibility and ability to perceive light and images clearly, making daily tasks more difficult. Vision loss not only reduces quality of life, but also increases the risk of accidents, social isolation, and mental health issues. Such are common causes of vision loss in older adults. 1. Natural aging, presbyopia. As people age, components of the eye such as the lens, ciliary muscles, and retina begin to deteriorate. One common manifestation is presbyopia, difficulty focusing on nearby objects. Elderly individuals often struggle to read or must hold objects farther away to see clearly. This is a natural and nearly universal age-related condition. 2. Cataracts. Cataracts are the leading cause of vision loss in the elderly. The lens, which helps focus light onto the retina, becomes cloudy, causing vision to blur, like looking through a fogged-up window. Cataracts develop slowly and may not affect vision early on, but without treatment, they can lead to complete blindness. Case example: Mr. T, 69 years old, initially experienced blurred vision in the afternoons. Months later, he could no longer read phone numbers. An eye exam revealed bilateral cataracts. After surgery to implant artificial lenses, his vision significantly improved. 3. Glaucoma. Also known as the silent thief of sight, glaucoma is caused by increased intraocular pressure that damages the optic nerve. The disease progresses silently and often remains unnoticed until irreversible vision loss occurs. 4. Age-related macular degeneration, AMD affects the macula, the central part of the retina responsible for sharp vision. Patients gradually lose the ability to see fine details like faces or text, although peripheral vision remains intact. AMD is a leading cause of permanent vision loss in developed countries. 5. Dry eyes and chronic conjunctivitis. With age, tear production decreases, leading to dry, irritated eyes. Older adults are also prone to chronic conjunctivitis, which can further impair vision. 6. Complications from chronic illnesses. Poorly controlled conditions such as diabetes, hypertension, and hyperlipidemia can damage retinal blood vessels, leading to diabetic retinopathy, retinal hemorrhage, or macular edema, severely affecting vision. Recognizing the symptoms of vision loss. Older adults with vision problems may experience blurred vision, especially in low-light conditions. Difficulty reading, needing to hold text farther away. Light sensitivity and glare discomfort. Eye fatigue, frequent rubbing or watery eyes. Increased risk of tripping or falling due to unseen obstacles. Trouble recognizing faces or expressions. Fluctuating vision, sometimes clear, sometimes blurry. Eruidubon, chronic consequences of untreated vision loss. If not diagnosed and treated promptly, vision impairment can lead to loss of the ability to read, write, or watch TV, affecting daily routines and emotional well-being. Higher risk of falls and injuries, especially hip fractures, a leading cause of indirect death in the elderly. Reduced ability to care for oneself, increasing dependence on others. Increased risk of depression and social isolation due to poor communication and loss of confidence. In severe cases, permanent, irreversible blindness. Prevention and vision care for the elderly. To preserve eye health in old age, a combination of proactive measures should be taken. 1. Regular eye exams. Elderly individuals should undergo comprehensive eye exams every 6 to 12 months to detect serious conditions like glaucoma, cataracts, or AMD early. 2. Use proper eyewear. Wearing appropriate reading glasses, prescription lenses, or blue light blocking glasses helps improve vision and reduce eye strain. Glasses should be prescribed and fitted by a qualified specialist. 3. Timely treatment conditions like cataracts, glaucoma, and diabetic retinopathy should be treated promptly with medication or surgery to prevent progression. 4. Balanced nutrition. A diet rich in vitamins A, C, and E, as well as lutein, zeaxanthin, and omega-3 fatty acids, benefits eye health. These nutrients are found in carrots, leafy greens, e.g., spinach, kale, salmon, mackerel, eggs, and nuts. 5. Protect eyes from harmful light. Limit screen time on phones and tablets. Read in well-lit environments. Avoid reading in the dark. Wear UV protective sunglasses when outdoors to shield eyes from harmful ultraviolet rays. Final thoughts: vision loss is one of the most common and serious health challenges faced by the elderly. If not detected and managed early, it can significantly hinder daily functioning, lower quality of life, negatively impact mental health, and increase the risk of accidents and even death. Therefore, individuals, families, and communities must pay proper attention to elder eye care. From regular checkups and appropriate nutrition to creating safe, vision-friendly living environments. These steps are key to helping older adults live happily, healthily, and independently in their later years. Hearing loss in the elderly. Overview of hearing loss in older adults. Hearing loss is a common yet often overlooked health issue in the elderly. According to the World Health Organization, WHO, more than 1/3 of people over the age of 65 experience some degree of hearing impairment. Hearing is not only essential for communication and social connection, but also plays a critical role in maintaining balance, environmental awareness, and daily safety. Hearing loss in the elderly is not solely the result of physiological aging. It can also stem from underlying medical conditions, environmental factors, lifestyle habits, or side effects of certain medications. If not detected and managed in time, it may lead to social isolation, depression, reduced quality of life, and diminished ability to communicate with loved ones. The common causes of hearing loss: degeneration of hair cells in the inner ear, presbycusis. This is the leading cause of age-related hearing loss. The inner ear contains thousands of tiny hair cells responsible for converting sound waves into nerve signals sent to the brain. Over time, these cells deteriorate, especially those that process high-frequency sounds such as soft voices, bird song, or phone ringtones. Real-life example: Mrs. Jonah, 75, a former kindergarten teacher, recently began asking family members to repeat themselves frequently and responded slowly during conversations. A medical checkup revealed age-related hearing loss, and she was prescribed a hearing aid. Prolonged exposure to loud noise: individuals who worked in noisy environments, such as construction sites, factories, or bus stations, or who habitually listened to loud music or TV for years, are at high risk. Chronic noise exposure damages auditory nerve cells, resulting in irreversible hearing loss. Excessive earwax buildup. Earwax protects the ear canal from bacteria and dust. However, when it accumulates excessively without proper cleaning, it may block sound transmission and cause a sensation of fullness or blocked ears. Example, Mr. Peter, 68, noticed reduced hearing in his left ear. Doctors found a large earwax plug obstructing the canal. After removal, his hearing returned to normal without needing a hearing aid. Chronic ear infections, otitis media tes externa. Long-standing infections, if untreated, can damage the eardrum or ossicles, tiny bones in the ear, impairing sound conduction. Older adults with weakened immune systems are more susceptible, especially when ear hygiene is poor or hearing devices are unclean. Vascular conditions, diabetes, and drug side effects. Chronic conditions like diabetes, hypertension, and dyslipidemia can impair blood flow to the inner ear, leading to reduced auditory function. Furthermore, certain medications, such as aminoglycoside antibiotics, diuretics, and chemotherapy agents, can be ototoxic, damaging inner ear structures. Common symptoms of hearing loss. Unlike acute illnesses, age-related hearing loss develops gradually and subtly, making it hard to detect in the early stages. Common symptoms include difficulty hearing in noisy environments, e.g., markets, restaurants, social gatherings. Trouble understanding soft or fast speech. Frequently asking others to repeat themselves or speak louder. Increasing TV or radio volume, often noticed by family members. Mishearing words leading to inappropriate responses. Tinnitus, ringing, buzzing, or whistling in the ears. A sensation of blocked ears, especially when changing altitude or air pressure, e.g., flying, hiking. Consequences of untreated hearing loss. Impaired communication. Hearing-impaired seniors may withdraw from conversations due to fatigue, frustration, or embarrassment. This leads to social isolation, disconnection from loved ones, and loss of enjoyment in life. Increased risk of depression and dementia studies show that people with hearing loss are twice as likely to suffer from depression. Additionally, reduced auditory stimulation contributes to cognitive decline and increased risk of dementia. Safety hazards in daily life. Hearing-impaired individuals may fail to detect critical sounds such as vehicle horns, fire alarms, or gas leaks, resulting in accidents or delayed emergency responses. Prevention and hearing improvement for the elderly: regular ear checkups and proper earwax removal. Older adults should have their ears examined at least every 6 months. If sudden hearing loss in one ear occurs, seek immediate medical attention. It may indicate inner ear stroke. Only trained personnel should clean excessive earwax using specialized tools. Never insert objects deep into the ear canal. Use hearing aids when necessary. Hearing aids are effective tools that amplify sound and support communication. Many modern devices are discreet and comfortable, placed behind or inside the ear. Proper usage can greatly improve quality of life and reduce feelings of loneliness. Avoid prolonged noise exposure. Don't listen to music at high volume through earphones. Avoid staying too long in noisy environments, such as factories or construction sites. Use noise-canceling earplugs or specialized headphones when necessary. Nutrition for healthy hearing. A balanced diet rich in vitamins and minerals helps protect auditory nerves. Vitamin B12, eggs, meat, salmon, supports nerve function. Zinc, pumpkin seeds, beef, seafood, antioxidant and hearing protective effects. Omega-3, fatty fish, flaxseed oil, promotes blood flow to the inner ear. Practice listening in quiet environments. Create quiet settings during conversations. Avoid background noise from TV or music while talking. Encourage daily communication and auditory memory exercises to maintain hearing reflexes. Recommendations for seniors and families: monitor hearing daily. Pay attention to early signs such as difficulty understanding speech, especially in crowds or needing repetition. If you feel your ears are blocked or sound seems distant, consult an ENT specialist promptly. Have regular ear exams every 6 to 12 months. Don't wait until hearing severely deteriorates. Routine checkups help detect issues like infections, earwax buildup, or inner ear damage early. Use hearing aids properly if required. Don't hesitate to wear hearing aids. They support normal living, not weakness. Consult a specialist to select the right device based on frequency and hearing level. Clean devices properly, remove when not in use, and keep them dry. Protect ears from prolonged noise exposure. Avoid extended stays in loud environments like construction sites, weddings, karaoke bars, or busy streets. Use noise-reducing earplugs or filtered headphones when necessary. Avoid using headphones at high volume for long periods. Eat a healthy diet, good for auditory nerves. Include foods rich in O vitamin B12, eggs, liver, milk, seafood, O zinc, seafood, pumpkin seeds, soybeans, O omega-3, salmon, sardines, walnut oil. Limit sugar and salt, especially for those with diabetes or high blood pressure. Maintain daily communication habits. Regular conversations enhance auditory processing and reduce depression risk. Join community groups, senior clubs, or hobby-based classes. Family support and patience are crucial. Talk to elderly relatives in quiet places. Maintain eye contact to help them read lips. Speak clearly and gently. Avoid shouting, which may hurt their feelings. Offer emotional support and create a welcoming environment so they feel comfortable sharing hearing concerns. Final message. Hearing loss in the elderly is a natural process but can be detected early and managed effectively. Public awareness, combined with medical care, proper nutrition, and emotional support, are key to helping seniors maintain communication and enjoy life fully. Don't let silence disconnect our loved ones from the world. Let's care for their ears and preserve the sounds of life.